All right, so let's go down and talk about our fourth and our last acid-base imbalance problem. So the last one we're going to talk about here is going to be metabolic alkalosis. Now this, we talked about metabolic acidosis being an excess of acid other than carbonic acid. All right, but metabolic alkalosis is too much bicarb. It's an excess of bicarb in the blood. And so it's buffering off some of the acid which is needed, because remember, ABGs are about balance. pH is about balance. You got to have a little bit of both, not too much of one or the other. So you will see metabolic alkalosis. This is going to occur with a loss of acid. So at the bedside, this can be due to somebody that's got increased vomiting. So this can be, say, your cancer patients that are receiving chemo. This can be due to any type of problem that causes the patient to vomit too much. So it can even be a head injury too. I've seen patients that have had a head injury that has triggered, this vomiting center in the brain, and they just projectile vomit for no apparent reason. So that can cause problems. That's not very common. Most often what you're going to see is vomiting related to some sort of disease process, probably, cancerous. Pain can be related to, cancer treatment. That's what I've seen most often. But really, the biggest problem at the bedside is going to be your gastric suctioning, otherwise called, hooking the patient up with an NGT to suction. So when you have someone, and this happens a lot in your abdominal surgeries, when you have someone that has a very big abdominal surgery and they have to be NPO for, 3 to 7 days. I mean, I've seen patients that have had, parts of their bowel removed, and, their bowels just take a while to start working again. Then they can be in PO for, 5 to 7 days. And during that time, they need to be hooked up to suctioning, because if that gastric juice has nowhere to go, it's just going to build up in the stomach and cause problems. That's why we suction it out. But what happens is continued suction over time suctions out your gastric juices. And your gastric juices are very high in, it's got an acidic nature, because it, kills off bugs that we eat. Gross, but we do actually eat a lot of bacteria, and all of that needs to be killed off before it gets absorbed into the system. So when you're suctioning off those gastric juices, which are high in hydrogen ions, which is an acidic nature, then it's going to reduce the amount of acid overall in the system. So suctioning off those gastric juices. Now, one of the compensatory mechanisms is for your body to lower the respiration rate. But like I said, when it comes to ABGs, the compensatory mechanisms don't always work very well. Your body is basically trying to help, but it's not necessarily going to be successful. All right, so that's an overview of our 4 things that can happen to cause an acid-base imbalance in our patient. So now let's get down to interpreting ABGs. Now this is called ABG bingo. And let me show you this other slide really quick. We have this slide that is called Rome, and this is to, when you're first starting out interpreting ABGs, try to help you a little bit. So it's called Rome, and it is respiratory, opposite, metabolic, equal. All right, so let's go back to our previous slide and we'll talk about this. All right, so respiratory, opposite, metabolic, equal. So what we're talking about here is these arrows. So when you're interpreting an ABG, you're going to put an arrow. Is your pH high or low? Is your CO2 high or low? Is your bicarb high or low? So this is what we're talking about with Rome. So say for respiratory acidosis, your pH is going to be low, right? It's going to be less than 7.35. So that's low. Now, our value that is related to the respiratory system is your CO2. So we're going to look, is your CO2 high or low? So in respiratory acidosis, your CO2 is going to be high because it's going to be greater than 45. All right, so you can see your arrows are opposite of each other. That's what we mean respiratory opposite. Now in respiratory alkalosis, your pH is high, but your CO2 is going to be low. So again, respiratory opposite. These arrows are opposite. They're going in the opposite direction of each other. All right, so that's Rome opposite. So let's talk about metabolic equal. So when we're talking about the metabolic portion of ABGs, problems with the pH that are caused by bicarb being too high or too low, then you would expect those arrows to be equal. So in metabolic acidosis, with acidosis, your pH is going to be low. And if that pH is low because of a bicarb issue, acidotic, then you would expect your bicarb to be low. So you can see that these arrows, metabolic equal, they're going in the same direction. And the same goes for your metabolic alkalosis. Your pH is going to be high, up arrow. Your bicarb is going to be high, up arrow. So metabolic equal, those arrows are going to be in the right direction. The big thing here is just to remember that you have to associate the correct value in order to really understand. So let me choose a different color here. So our two values are our CO2. You need to connect that with the respiratory system. And then our bicarb needs to be corrected to the metabolic system. So when we're talking about respiratory disorders on the ABG, we're looking at CO2 levels that are out of whack. When we're looking at metabolic problems on the ABG, it's going to be bicarb levels that are out of whack. Okay, so we talked about Rome. This is one slide one graph that really helped me to understand. I used to get really confused with ABGs, and it was just like, up arrows, down arrows, up arrows, down arrows. So what really helped me was just to simply look at, this pH and what really makes acidosis. So when we're looking at this slide here, I'm going to kind of mark out this alkalosis right here. What makes something acidosis? If I can just remember what makes something acidotic, then it's easy to remember that the opposite of that is going to be alkalotic. So what makes something acidotic, acidosis? That is going to be a low pH, anything less than 7.35. All right, so what makes your pH levels acidotic? An elevated CO2, anything above 45. For your bicarb, it's going to be a low bicarb, anything that's less than 22. So if I can memorize that, that makes it a little bit easier, because then I know the opposite of that is going to be alkalotic. All right, so just like when you're interpreting dysrhythmias, rhythm strips, telestrips, EKGs, there's a certain process when you're first starting out and you're first learning that you need to apply to every single ABG every single time. And what I mean by that is, we're not going to be hot dogging anything. Okay, 100% of the time you're going to play Name That ABG, because that's really the best consistent way to learn and to prevent confusion. And you'll learn very quickly. Because some people, of course, we're all different. Some people pick this up right away. Other people, like me, it took me a little bit to really grab this concept before the light bulb came on. So I'm just sharing with you the tools that I learned that helped me. When somebody sat me down and showed me this, this helped the light bulb to come on. So I'm now sharing it with you. All right, so you need to ask yourself, for the purpose of this video, we're going to not worry about compensation at this point. These two questions. pH, is it acidotic, alkalotic, or normal? pH. All right, your second question is it respiratory or metabolic? And what we mean by that is, where is the abnormal value? Is it your CO2 or your HCO3? If it's a CO2, then you're probably looking at something respiratory. If it's HCO3, then you're looking at something metabolic. So that is your two questions. Is your pH acidotic or alkalotic? And is your CO2 abnormal or your bicarb abnormal? So let's go down and do a practice ABG. All right, so we're going to put our little cheat sheet up here in the beginning to help out. And then as we go down the slides, we're going to take that cheat sheet away and start trying to do it by memory. All right, so what's our first question? Is our pH abnormal? Is it acidotic or alkalotic? All right, well, we can see that it's 7.30. All right, that's too low. So we're going to put a down arrow. It's low, which means it's acidotic. Now we have to look at our values. Our CO2 level, is it high or low or normal? So our CO2 levels, normal is 35 to 45. We can see that 56 is too high. And that's what? Acidotic, right? Too much CO2 is too much acid, so that's an acidotic state. Now, our bicarb, we're going to look at bicarb, normal, high, or low, falls within the normal limits. So we know that our bicarb is low. So now this is a two-part question. So we're going to put a little slash down here. When we interpret the pH 7.30, is it acid or is it alk? It's acid. That is the second portion of our answer. So we already know just by looking at the pH that the second half of this answer is acidosis. All right, now our CO2 is abnormal and our bicarb is within normal. So that tells us what the culprit is CO2. That's too much CO2 is leading the pH to an acidotic state, and CO2 is which system? Respiratory. So there you have it. You have interpreted your first ABG. We're looking at an ABG that represents respiratory acidosis. Now, if we talk for a quick second about compensation. Compensation can be confusing, but compensation is actually pretty basic. If you want to know if something is compensated, your pH level has to be within normal limits in order for an ABG to be compensated. So if we were going to say that this was compensated respiratory acidosis, what we would be looking at is the body would start increasing bicarb in order to help buffer off some of this acid. So you would see that maybe this bicarb would go, I don't know, 36, 40, somewhere. It would start elevating. And then what will happen is, because this bicarb is elevating and buffering off some of this acid, you're going to start seeing changes in your pH, and your pH would at some point start to get within the normal limits. So say your pH was 7.36, your CO2 was 56, and your bicarb was 40. Then you could say that that was compensated respiratory acidosis, because you can clearly see that the CO2 level is high, which is CO2 is very powerful, much more powerful than base. So that's going to lead to an acidotic state. You can see that your pH level is within normal limits, but where's it at on that normal scale? Well, it's only, what, 1/100th, of a point above normal. So it's closer to the acidic state, than it is an alkalotic state. So that's compensating and partial compensation. That's really going to come more with practice. But for figuring out our basic ABGs, we did that right in the beginning. Your pH was 7.30, which is acidotic. That's the second portion of the question. Your CO2 was high, which is acidotic. That's the first portion. So that basic ABG is respiratory acidosis. All right, so here we are at 15 minutes. We're going to stop and move on to video number 3.